All right. Well, I had good morning written, but I realized it's good afternoon now. On the 1st of October, hard to believe. For those of you who don't know me, I'm Jennifer Buchanan, the manager of membership and engagement with the Chamber. I know we have a topic of great interest for you all today. We've got some great guests, and I think it'll be a really interesting conversation. So as we get started, I'm going to pass it over right now to our board chair, Kyle Burgess, for a few announcements. Kyle.
Thank you, Jennifer. Hello, everybody. As Jennifer indicated, I'm the chair of the board with the Chamber and also a senior employment lawyer with Minkin Employment Lawyers. Thank you very much for coming today for this special Zoom at Noon event to help us understand a very popular and talked about topic of proof of vaccination mandate. I want to begin our meeting in a good way by acknowledging the land that we live and work on. This is an important step on our path of truth and towards reconciliation, which is the work of all Canadians. I want to acknowledge that we are on the traditional territories of the Wendat, the Haudenosaunee, and the Anishinaabe peoples, whose presence here continues to this day. We also would like to acknowledge this is the unceded treaty lands of the First Nations of the Williams Treaty, and thank the signatory nations respectively for sharing these lands with us. We would also like to acknowledge the Chippewas of Georgina Island, First Nations as our closest First Nation community, and we extend the hand of partnership to them so we can live in a good way and in accordance with our treaty agreements. We are all treaty people and we all have responsibilities to the treaty agreements. I invite you to find out more about the treaty that you live on and consider not only the way that the land shows up for you, but how you can show up for the land to live in reciprocity. I would also like to acknowledge the following board member who is also in attendance here with us today, Pierre Bonhomme, our board treasurer. You will notice that this session is being recorded, and there are also subtitles that are available. If you don't want the subtitles on, there is an arrow at the bottom under subtitles that you can click to turn them off if it's not something that you're wanting for today's session. Thank you very much to our guests for agreeing to share their expertise with us this afternoon. We will be hearing from them very shortly. But before we do, I would like to introduce the Chamber's brand new president and CEO, Tracy McGruthers, to address the membership that's present here today. Tracy, I'm going to hand over the virtual microphone to you.
Thank you, Kyle. It's a pleasure to be here today. It's day 3 in my new role. I look forward to working with all of you in the days and years to come and welcome you today to this informative session. So thank you, Kyle.
All right, thank you very much, Tracy. And with that, I'm going to hand this over looking at the time, I'm going to hand this over back to you, Jennifer, to take over.
Thanks, Kyle, and welcome, Tracy. So as of today, we're at the 10-day mark. That's been 10 days since Ontario's vaccine passport came into place. It's, of course, meant another adjustment for businesses, and there's been no shortage of opinions on it since taking effect. So with that, I'd like to pass it over now to Newmarket Mayor John Taylor, who's going to speak from a municipal and regional standpoint, and please just give us an update from the town, Mayor Taylor.
Great, thanks so much. Thanks very much, Jennifer. It's always a pleasure to be here and be a part of these conversations, and I think they're incredibly productive, and it's a great way for the business community to communicate, but also for myself to have the opportunity to sort of listen to the conversations and understand some of the thoughts and concerns of the Chamber membership and of the business community in Newmarket. And I want to start off by saying welcome to the new Tracy. Tracy, welcome, and I look forward to working with you very, very closely over the coming months and years. You know, the Chamber always works extremely closely together, but certainly through and coming out of, and we hope what is coming out of a pandemic, the need to work closely together is greatly accentuated and needed. So I look forward to that very much.
Thank you, Mayor Taylor.
So I thought I'll just start by maybe giving people an overview of where we're at with COVID a little bit. I think people know this to a large degree, but I think we'll start with what is largely, I believe, a good news story at this point. You know, we've administered here in York Region now, I believe it almost 1.6 million vaccines. So a very significant undertaking logistically and in terms of public health. So of that, we're now at about 18 plus is at about 86.3% first dose, 82.6% second dose. And 12 to 17-year-olds, which is the new group we're talking about a bit today as well, is 82.8% first dose. So, we can see that when we look at the full grouping, the rate is quite high, and we've got reason to believe we can have a realistic shot of hitting 90% of eligible people in York Region and in Newmarket. And we believe 90% will start to get us to a very comfortable position. But having said that, the cases for quite a while now, and of course, I think we all have, and I've been watching very closely, through September, because, we thought, well, back to school and some easing of restrictions, and, we got to really be cautious here. And really, the numbers have held pretty steady through September. Right now, what we're looking at is let's see, the York Region cases are, hang on, there they are, sorry. Yeah, so Newmarket, the last day reporting, and this has been typical for Newmarket, 3 to 1 to 7 cases a day. So the last day was 3 new cases. York Region was 34. That can get up as high as 80 some days. And Ontario was about 500. And we know that can be, 600, 700 some days a little less. But generally in that range is what we're dealing with. And so those numbers seem to be very manageable. I spoke with Arden Crystal just the other day, and ICU is not very impacted right now at South Lake. So we're in good shape. The vaccination numbers are going up. In fact, the 12 to 17-year-old numbers are obviously going up with some of the new announcements. And that's an important cohort, because actually a lot of activity in that cohort now compared to when this pandemic started. So we track those numbers very closely, our medical team. We have a new medical officer of health now. Dr. Kurji has just retired, for those who are not aware of it. I think yesterday or today, it was the turnover day. And so Dr. Richard Gould is now the new medical officer of health, and I'll make reference to him later on. But we're in a good position, I think. We need to keep getting those vaccination numbers up in order to feel very, very confident. And before I talk about sort of the vaccine mandate and where we're at with that, and what I wanted to, though, is sort of couch the positive numbers I've just provided. There's still reason we need to be thoughtful and cautious. And I know that this can sometimes sound like government with a broken record. Be careful, be cautious. We need to keep we need to keep masks, and we need to keep distancing. And people are sort of easing off on that a little bit. But really, take this fairly seriously. Scarzen does the modeling for York Region, and they're yet to be wrong, pretty much. I mean, they work within a range, but they're yet to be wrong. And they're predicting that York Region, keep in mind, I just said that we were at 34 new York Region wide yesterday. Scarson is predicting that that'll be about 250 by December the 1st. So that's a significant increase. Now, 35.4 is on the lower end of our range, but you're still looking at a quadrupling. And so those kinds of numbers will start to impact our ICUs again. And the variants of concern and how they work are still really baffling. And the best way I can put it for people is I was reading the Globe and Mail this morning, and then I wanted to understand a little more, and I did a little research today. The island nation of Guam. Now, this will sound odd, but I mean, it really is telling for everybody. We think about what's going on in Alberta and other places in the US. Guam is about 160,000 people. They are at 90% vaccinated. They're one of the success stories globally. And they just had a 4th wave. And the 4th wave is, think about it. What are we at? 34 new cases in York Region, 1.2 million people. They have as high as 300 cases a day right now with 90% vaccination. So we don't fully know what we're dealing with yet here. And I know no one wants to hear this. No one wants to hear this. When I read the article, I literally said to my wife, no, I don't want to hear this. Because we want to believe that it's just, we get to 85 or 90% vaccination and the sun starts shining and we're back to normal. I hate to say it to people, and I don't want to depress you on a Friday, but that's just not what it's looking like. I think we're going to be figuring this out for a while, and there's going to be some need for some measures. I hope with the vaccine mandates and some basic measures that we never, ever have to go backwards in terms of restrictions or closures for businesses. And that's why one of the main reasons I'm such a big supporter of the mandates, because, to put it simply, if somebody says to me, and I know there's a few people that say, well, it shouldn't be a choice between one or the other. I think unfortunately it is. But if the choice is between mandatory vaccines in many or most settings versus heavier restrictions, less people allowed in restaurants or even small businesses or closures, I'm for vaccines. I do not want to see us ever go back to that territory again. So having said that, as you know, the province came out with the vaccine mandate. We'll be talking about that, I'm sure, a little bit, and certainly we can have questions about it. I'm no expert, but I've got a fairly good understanding, and that applied to many spaces and affected many people here. And I know part of the challenge is the logistical challenge and the staffing challenge. And while we're not as constrained as many small businesses are, the town of Newmarket is going through the same thing. We're trying to quickly figure out how to screen for this, how to have the staff in place, and how to manage it in multiple facilities that were also affected. But we know event spaces, conference convention centers, restaurants, bars, dance places, casinos, sports, recreation, water parks, personal fitness, concert venues, theaters, all of those and more have been affected by this mandate. Again, I will say, and I'm sure there will some people won't agree with me, and that's part of the democratic process. But I think I support this direction because, again, I'd rather have a mandate that says you must be vaccinated to get into places than have to shut those places down again. It's just, for me, it's very simple and straightforward. There was, and there might be some people interested in this, but there was an anomaly in the announcement, and it's one of the, and I'll call it an inconsistency. The province might not agree with me, and that's okay. And it's the ones that frustrate people, but they did make an exception for organized sport. And so the town of Newmarket was in the odd position of saying, okay, so believe it or not, at a Magna Center, like our Magna Center, close to half of the people that come in there are not for organized sport. They're drop-in programming, they're learn to skate or pick up hockey or pick up various things, ringette. And so we were like, okay, so all of those 15-year-olds, for example, let's take your average 15-year-old, have to be vaccinated, double vaccinated, but those in organized sport don't have to be. It didn't seem fair to me, and it didn't seem actually easy to administer. And so we decided that we were going to take the position that all 12 to 17-year-olds coming into our facilities would be treated the same. And so that seemed to me the logical place to go. And a number of other municipalities, we were the first followed that direction, seeing it as logical. But we gave till November the 1st because we wanted people the chance to be able to comply if they wanted to, especially if you got, your kids don't want to miss their sports and you don't want them to miss it, or they're highly competitive or whatever. So we provided that ample runway of 6 weeks. Then the region came out and announced that they were going to mandate this across the board for including organized sports for starting today. And this was 2 days ago. So that gave people no time. And as you can imagine, many gyms and facilities and private skating and recreation facilities were greatly concerned, as were we. And then we decided, the town of Newmarket, to try to find a very delicate position related to that position. The position we took was that we support the medical officer's health direction. However, due to operational considerations, we would not begin to enforce it until November the 1st. So technically it's required, but it wouldn't be enforced to you. So if you come to the Magna Center, you'll be asked, even if you're 15, even if you're in organized sport, and you'll be told, you need to be double vaccinated. Can you show me proof of vaccination? If they cannot, they'll be told, well, you should be, and please understand, as of November 1st, we'll enforce. But it does provide that kind of flex room. Since then, the region has come out and said they will be, I think the phrase was, for several weeks, focusing on enforcement only. And Richard Gould today on I don't know if it was CTV or CBC, I saw reiterated that position, that their focus would be on education for some time, and that they would look to enforcement after several weeks. And so I think that's the position. And it's a hard one to explain for anybody on the call that's in that category. I would suggest that you're probably safe to be providing flexibility, but reminding people and letting them know November 1st is coming. And that's just trying to find a balance between public health and respect and understanding the business community and the needs of young people to be healthy and active. So I think that's sort of a quick overview on the vaccine mandates that we have at this point. Could they go further one day? Maybe. I look to Guam and go, wow, if 90% doesn't do it, well, and obviously we also start to adjust now in a vaccine world to starting, we've got to learn to live with COVID, and we can't be shutting everything down all the time. And so we're not probably, we're in the midst of, as a society, accepting that there are going to be people who still get sick, even some vaccinated people, although this is largely unvaccinated people who are getting significantly sick. And we'll try to work our way through it. But I guess my message to everybody is, please try to do everything you can. Please try to be as safe as you can. That's the key to us not having to go backwards. And hopefully we're going forwards, and hopefully the next steps are better steps and less. But I think for a while with this, we're going to be looking at, wearing masks in grocery stores and different places, and thinking about distancing, and thinking about, tracking and tracing and keeping records for a while. And hopefully we get systems and passports that are easier to administer for businesses. And hopefully that we don't have to have any restrictions on numbers very soon that can go into businesses, but maybe restrictions about who can and wearing masks. And let's try to keep the local economy and the national economy strong as we can through these challenges. So I think I will leave it with there, and we'll, whether now or later, we can answer questions if there are any. But again,
Certainly.
And I just close as always to thank you to everybody for your perseverance, your patience, and your participation in all of this process. It's been very difficult, very confusing, very frustrating, and not easy. But it really does show the strength of the community, the way everybody's trying to do their best and trying to support local business and shop local, and out of respect for your fellow colleagues at your business, you want to support other local businesses, because that's one of the other ways we're going to get through this. Thank you.
Thank you, Mayor Taylor. And certainly, when I just have to say quickly, when you talk about we're going to be wearing masks for a long time, we've all adapted, right? But I was recently on the East Coast, and we stopped through New Brunswick on the way home. Well, there's no mask mandate. And I went in, the gas station, and we got some food. I couldn't have imagined not having my mask. I was the only one wearing it. So, it, as much of it as an adjustment it was for us to wear them, I think it's going to be a real big adjustment when we do reach that time where, we don't have to wear them. With that, we have two other special guests with us today. We have Danielle Cephiani, who is the Vice President of Policy at the Ontario Chamber of Commerce. And we also have Treasure Beauchamp, the Director of Field Logistics for Workplace Safety and Prevention Services. So thank you both, gentlemen, for joining as well today. I'm going to go to you first, Daniel. I know that the OCC has developed a framework that outlines some guiding principles for the private sector when it comes to the vaccine mandate. So can I pass it over to you to just highlight that and shed some light on that for those who don't know what the framework entails?
Absolutely, Jennifer. Thank you for having me on, and just also did a bit of an East Coast trip myself, and just very quickly to pick up on what you were saying. New Brunswick right now, unfortunately, is confronting some consequences potentially from not having as aggressive of public health measures in place. So I want to support and echo a lot of what Mayor Taylor just said as well. It is, no business is rah, happy to be implementing this, but it is kind of a lesser of evils sort of situation in which we're trying to use all the tools in the proverbial toolbox, including incentivizing people to get vaccinated, rapid testing, vaccine mandates, and just on this, it's worth noting that some positive dividends have already happened here. Since the announcement in September, already an additional 300,000 Ontarians have rolled up their sleeves to get their first shot. And so not an insignificant gain on that front, given that we are trying to get as high in terms of the general inoculation as possible. Now, with that aside, Jennifer, you asked about what we had put together, and what we had put together was actually prior to the vaccine mandate being announced. we'd heard from many businesses looking to implement their own vaccine mandates for their own employees and their own policies to keep their place of business and workplaces safe. So we are not legal experts. So we did consult some thoughtful people at McCarthy's that were smarter than us when it comes to these things. And we put together basically 5 basic tenets, which we'd be happy to circulate in the chat box just after this. But 5 tenets stated that, businesses who are looking to implement a policy, if they follow these principles, they're going to be on safe grounds. And I have to say this as a caveat, no, this is not legal advice. But the 5 principles very quickly are safety. So businesses need to be guided by their obligation to take all reasonable steps necessary under the circumstances to protect the health and safety of their workforce and their place of business. Number 2 is around science. Any business implementing VaxPass programs acknowledge that vaccination-based entry policies are consistent with current science and COVID-19 medical recommendations in terms of public health best practices. Number 3 is around accommodation. And point here being that any policy needs to ensure some kind of reasonable accommodation to the point of undue hardship under the Ontario Human Rights Code. And perhaps we'll get into it in the Q&A, but Ontario Human Rights Commission did release a statement recently that's very relevant to this discussion. The 4th point is around privacies, and the privacy and the notion here being businesses should use the least intrusive mechanism possible to verify vaccination status, and keep in touch with policy developments as it relates to, for instance, government issued vaccine passports and how information is being kept or not kept on hand as it relates to that. And the last point is around transparency. Businesses should engage in clear, ongoing dialogue with employees, customers, and other partners about any policy that they choose to implement. Now, a lot of this, the context now has changed with the government moving forward with their own vaccine-based passport, but of course, importantly, that does not apply to employees, which is a big distinction to be made.
Which is perfect, because that's what my next comment / question was going to be to Trevor. I mean, it's probably one of the most common statements made in frustration I've heard from people and businesses. So people have to be fully vaccinated to walk into a restaurant, for example, place of business, but the employees don't. So Trevor, I know you're going to speak to that, and I don't know if you can shed any light on it or if things are going to change, but it's certainly one of the main things we're hearing.
Yeah, and I think, we got bits and pieces of the answers from both Mayor Taylor and from Daniel and in some of their discussion. What it really comes down to, we've been getting the question a lot, and people are mistakenly calling it an exemption, saying, why are workers exempt from this? And there's not an exemption for workers. What it is they fall under different legislation. There's a requirement, as Daniel mentioned, about the internal responsibility system when employers have that duty of care, that obligation to, identify all the hazards in your workplace and protect workers from those hazards. So there's still that obligation to do so. The other piece too is the Ontario introduced the Reopening Ontario Act during COVID. And the Reopening of Ontario Act has a specific requirement for all employers to have COVID-19 safety plans. And the Ministry of Labor, Training and Skills Development have made it very easy on their website. They have a self-serve sort of program builder that you can build and have your own policies. So having said that, in a nutshell, there is still a requirement for employers, and the workplaces are protected from the spread of COVID-19. Now, having said that, the way occupational health and safety legislation works in Ontario, it's based on this due diligence principle. It's not prescriptive. It doesn't say this is how you do it. And it's actually, not everybody will see it this way, but I see it as it's a luxury of allowing you to do it in a way that's best for your business. But the one piece I'll add to that, it's complicated when you're trying to figure on your own, but what Mayor Taylor was saying earlier is our recommendation to say, you know what, when it gets that complicated and you're managing a facility that says, oh, this group needs it, this group doesn't, you know what, it's well within your right as an employer to have a mandatory vaccine policy for your staff as well. And that's what we're encouraging people to do. I know that creates other legal complications, maybe if somebody absolutely refuses to, but boy, oh boy, it's what I've been saying to people, it's going to be really hard to work without a vaccine. And I'll use our organization as an example that, we're visiting workplaces all the time. We have a lot of workplaces that have adopted a mandatory vaccine policy. So if our staff can't go there and do their work if they're not vaccinated, we do a lot of training across the province in hotels. We have very little real estate across the province. Hotels are mandated. So our staff are limited in, the work they can do because of it.
And I think that's, there's a lot of still questions from businesses that, is there a line? Are they crossing it if they ask certain questions? But, and one of them, and I encourage anyone, if you want to put some questions in the chats, we'll get to it. But Pat Lusink asked, she's with Best Western, I'd like to know if I invite a person to an interview at the hotel and I meet them in a private office or in a meeting space, do they have to show her proof of vaccination? Hotel guests do not, but people using the meeting spaces do. And, there's that overall confusion. You can't help businesses for wondering what they're supposed to do.
Yeah. And I think that's a great question because I'll answer it in terms of meeting in the office. I'm confident in saying that's fine. That's not part of the venue. And the way the legislation is worded is it talks about hotels and, it talks about when entering the area that is considered a venue, proof of vaccination shall be checked at the entry point to the venue. So in a hotel like that, where you have guests who don't have to show it, so you don't have to check right at the front door, but as soon as you start making your way to those meeting rooms, upon entry to the meeting room, you'd have to show it. So if you have the option of meeting in your office or meeting in a meeting room, it's probably easier to meet in the office where you wouldn't have to ask for that proof if that's going to cause some complications.
I'm not sure who has the answer to this or just wants to weigh in, and I've been out and about meeting with members in the last few weeks as they were getting ready to, restaurants in particular, have to check vaccines and ID. Anybody see a need or call for, or will we see any type of government funding to help these businesses offset? I've been at a restaurant once and she was running around trying to check IDs and check, and the restaurants are saying, well, we can't afford to hire another person to stand at the door. So Mayor Taylor, I'll ask you to weigh in on that and any solution.
Yeah, I guess what I would say is that if you look at what we've experienced so far, and use that as a guidepost going forward, I would not be surprised if there was some government support coming to offset that. One never knows, but so far governments have been very responsive with dollars to try to offset impacts, not always the amount that some would wish, and not every corner or every aspect. But I think as more and more, and I think it might take a little bit of advocacy, but I think that what I've seen so far, I wouldn't be shocked if there was some sort of program at some point that looked at it, and it's interesting. It can vary so greatly. Like, that's the part of and I don't think health and safety, direction can really necessarily figure this out. That is where the government comes in to try to figure it out. But the impact of needing to do this on a place that has 1 or 2 employees only and has to add 1 more versus an organization that has 30 or 100 employees and has to add 1 more is dramatically different. And so that's the part that I think hopefully they that would be considered at the very least, if not a blanket support. But I would think some advocacy from different organizations and a bit of work, and it wouldn't be unrealistic to hope for that outcome.
Now,
if I could, sorry, Jennifer,
yes,
I could just
sure.
very quickly, since advocacy from some organizations was mentioned by the mayor, and so the mayor raises a very important point, though, because there is a difference between a bigger establishment which already has a staff dedicated to triaging people as they enter. You've seen this at many restaurants you've been to over the last 18 months. They take your information already. There's a difference between that versus a small independent store that only has a few people. The other side of this is labor availability equation. Even in an ideal world when financial resources available, well, is there the human capital available to fill that spot? But just very quickly, from the Ontario Chamber's perspective, we have been advocating for support, and specifically not only at the provincial level, but if you'll recall what seems like a short lifetime ago, before our federal election, we had our Prime Minister wave around a $1 billion figure that was intended to be used for provinces who were implementing a vaccine passport. Now that that election is behind us and Ontario is moving forward with the implementation of their vaccine passport, we're looking for follow-up on exactly that front to help ease the burden for particularly small businesses, who are many of them deeply indebted already at this point in the pandemic.
Well, and has there been any talk, because another issue that comes up with member businesses is restaurants, and I believe some retail, it's still restricted in, the amount of patrons they can have inside, yet those people have provided proof of double vaccination. And then now we have sporting events allowing more people, and Trevor's smiling and nodding, so maybe you can weigh in on this. You can't help but feel for the businesses that are saying, wait a second, we're doing everything we're supposed to. We're checking the vaccines, and we can still only have 50%. And for some small businesses, 50% isn't a lot of people inside.
And I'm smiling and nodding in agreement that I don't get it. And I'm sorry, I don't have an answer for that. I don't get how we can increase the number of spectators in a sporting venue like that, but yet still restrict independent businesses from increasing their crowds. I don't get it, and I apologize, I don't have an answer for that, but I can nod in agreement that I don't get it. It's
Daniel, I was going to say, did you want to weigh in? Are you, from your level, looking at advocating for that as well, or has there been any discussion?
So from the very start, when we've discussed the notion of vaccine passports, we've also talked about it in a way to actually ease public health restrictions and regain more rights and freedoms in exactly this way. And Illinois actually might have been one of the first jurisdictions to use a passport adjacent system to actually increase indoor capacity requirements and limits. And so, yes, we have been calling on this from government, but it's with an important caveat, which is, we're not the medical experts. We haven't been from the start, and it needs to be in line with the science and the guidance that's given. Obviously, as Trevor just mentioned, difficult to make it's not very intuitively explained if on one end capacity limits can be improved for certain venues, but not for others. But we have seen the government move on this a little bit. In September 25th, they did make an announcement increasing some capacity limits. And so, in line with the science and guidance, we hope to see more of that.
Another question that's come up is refusing to serve. So businesses wondering, what's the liability for human rights complaints if they say we're not going to accommodate, serve, or let in an unvaccinated person? Throw that out there if any of you want to weigh in on that.
Just very quickly, I mean, again, I'm not the legal expert, but the Ontario Human Rights Commission did issue a policy statement on this recently. And basically, they took the position that mandating and requiring proof of vaccination to protect people at work or when receiving services is generally permissible, as long as some protections are put in place to accommodate those who are unable to be vaccinated for code-related reasons. And there they stress the medical exemption part of it. But look, businesses who are following the rule of law and this vaccine passport program as outlined by the province should not be on the hook for any legal ramifications. Again, that's not legal advice, but that's what, businesses are just following the law. So there should not be an issue there.
If I can state something that's a little bit on the obvious side, but there's been a long tradition now, and everybody accepts it, of refusing service to people for health and safety reasons. And it's called refusing somebody if they've had too much to drink. That seems perfectly reasonable. So I just logically, again, I'm wondering why people see this as unreasonable. But anyway,
I mean, we all see the sign on, no shirt, no shoes, no entry, right? So, along that same line, Mayor Taylor, I wanted to speak to you about, you touched on education versus enforcement. So Is there, what's being done at the municipal level? Do you have bylaw officers going out? Is this being deferred to the region? How are you handling it? And I'm sure you've probably had some calls from both residents who aren't happy and businesses asking questions. So where are you at from the town's perspective right now?
Yeah, I mean, we're first of all, yeah, we do it. Our bylaw officers do a huge amount of education and a very small amount of enforcement throughout this. And in fact, as a ratio of population or staff, we have, because we track all the contacts for all 9 municipalities, bylaws, and our bylaw officers are out a lot, talking to a lot of people. Having said that, there is a little confusion about the rules here, but I think in terms of the vaccination mandate, it's relatively clear. And so the education period here we're dealing with for the next 30 so days is really more meant about being flexible. I think people probably know what they need to have in place by November the 1st. But it's trying to give people time to comply if they want to, number one, and give establishments and small business a little bit of time to figure out how they're going to manage it from a staffing perspective or financial perspective. And sometimes it's, in small business, it's a matter of a couple of partners talking about who's going to do what and when. And it's, and you have to maybe even make adjustments to how you're managing your family and other things. So it could be a little bit very impactful in small businesses. So it's more about flexibility on this particular one. But from an education perspective, I can tell you our bylaws team would talk to, thousands and thousands of people in a week and rarely lay a charge. We lay charges when people basically say, get lost.
Right.
I'm not going to do what you think or say. And then it's kind of like, okay, well, we're going to have to now take action.
I don't want to put him on the spot, and I'm wondering if he can hear me, but he's on my screen. So Pierce Simkin with Market Brewing. I'd just like to hear from you. It's been 10 days now. You and I saw each other for the Business Excellence Awards a few days before the mandate was taking effect. How he's quieting everybody around him. How have you dealt? How has it been? Has it been chaotic for you? Has it been busy? Like, speak to, from the business, how you're handling this.
Well, Mr. Mayor was here on Saturday, so he did see the chaos that sort of we can encounter here, as in, well, right now it's still early in the day, but we're pretty easy to see anyone coming in and check them out with their certificates and all that. But yeah, definitely on the busier days, as Mr. Mayor saw on Saturday, we do have a unique space here. So we have 2 front entrances, as well as when we always have the door open. So we have that option for everyone still on the patio, come in, get their drink, as no one needs their double vax to be outside still consuming, which still fortunate to still have that patio license. Maybe we can keep rolling it through the winter, which would be great. Heads up there, might get an email about that. But yeah, the largest thing that we have and concerning around us is we're a staff of 6 here, 2 guys in the back all the time, manufacturing and making the beer. And outside of that, it's hard to predict when we're going to be busy and we're not busy. And I'm sure it's like with any restaurant really around here. It's just, everyone seems to come in waves. That's another sort of term that we keep hearing over and over again. So there was this situation just on Saturday where we had 1 person working and other staff was coming in within 45 minutes, but it was just a rush, bang, 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 bang. So the way we're sort of doing our best to work with the guidelines that we've been given and just to manage what we have is, with our service, it's always been come to the bar. We don't do table service. And then from there, we'll check everyone's certificates and all that, make sure they have the right ID. If they're just coming in for retail, again, with the different doors, it's just come over here, in and out, no problem. If you're going to the patio, in and out, no problem. You're coming to sit down inside. When they order their drink, that's when we sort of approach the question of 1, please check in just for contact tracing. We're still continuing up with that, even though I know it's sort of been left on the wayside, but we truly do believe to get through this properly, you got to do everything you can. So we're not trying to skip it on anything. So we still are suggesting and mentioning everyone to sort of check in there. And then it is a reminder when you do check in, just in case, if you haven't already, one of the first questions is like, you still have your certificate with a government issue ID to match them up. So those are little things that we've like able to sort of do a little step extras. But the biggest thing is definitely like, we don't have like
Extra staff.
Yeah,
Right.
exactly. The extra staff to stand by the doors and just sort of check everyone coming in. So I did mention to you when you were here earlier, is like, hey, if the government's willing to give us some sort of extra subsidy to have someone stand there, I have no problem doing it. But at this point in time, with going from a 23 staff before COVID down to 6, like we're already wearing so many different hats. So yeah, that's sort of where our frustrations with everything are. But again, everyone else are coping and getting through it. So that's
Well,
sort of
thank you. I didn't mean to put you on the spot, but I saw you, so I was just actually also curious to see how you were coping. And Daniel obviously mentioned that they're advocating for that. But Trevor, do you have any advice for businesses like Pierce, and in terms of laying out that plan just to make things a little bit easier from the workforce for them?
Well, it sounds like you have a pretty good plan there now. One thing I think that's really difficult to manage is your type of business or any restaurant that has an outdoor space and an indoor space, and people come from the outdoor to the inside to pick up their drink or coming in to make a retail purchase. Because you're right, if you're coming in for a retail purchase or making a delivery, you're not required to check. That could be a nightmare to check people. And you got to go back to the premise of the Occupational Health and Safety Act and say to take every precaution reasonable. And I don't think it's reasonable to expect a business that can't afford to bring in another employee to do this. So this is the best we can do with what we've got, I think is reasonable and acceptable. And one question I've had that I haven't got an answer to yet is, so the legislation says that vaccine passport shall be checked at the point of entry. But the problem is that some people are allowed in without it. Some people coming in have to have it. It's hard to manage. So I think you have to go back to that premise every single time. Take every precaution reasonable. You're in a business that you can't have somebody at the door, but it's reasonable for the people working at the bar to ask when people come up, right? And one thing I want to add to that probably is prevalent in your business and many others, and Mr. Mayor mentioned it earlier, talking about it's important to have that education period before you get to enforcement. So if you're a facility that has a mix of people coming in, some require it, some don't require it, and you want to make it your policy to say everybody coming in has to require it, there's a huge benefit to that education window, because one thing that I'm sure everybody on this call's got a story or two, violence in the workplace incidents are through the roof right now. And another premise under the Occupational Health and Safety Act is that when you've identified a hazard and you're trying to control that hazard, rule number one is it shouldn't create a different hazard. And that's exactly what we're into now, where, okay, so we're going to say everybody's required to have a vaccine. I don't care what the law says, we're going above and beyond. You're going to get some people that are going to argue with you, and they're going to harass your staff. And unfortunately, people are being assaulted. And so, when you think about take every precaution reasonable, I think it's reasonable to say, take advantage of that opportunity to say, November 1st, we're going to have a mandatory vaccine policy. So in the meantime, I just want to take the opportunity to remind you that this is the direction we're going, and try to circumvent some of those violence episodes, because that's becoming dangerous in itself.
That's a question in the chat right now. We're getting people who are verbally nasty when they're inquiring about renting a meeting space. We tell them the meeting convener and their guests all need to show proof of vaccination at the front desk. I'm sure people don't want to start, do they call the police? How many times do they call? Is it right? Like, this is, as you said, this is going to be an ongoing issue even beyond November the 1st, I'm sure.
It is. And it's, I think your safest bet is what I'm finding right now. People are still conditioning to this, and we're constantly reminding people that, hey, all we're trying to do is we're trying to comply with the advice from the medical professionals and the lawmakers in the province. But for some reason, a lot of people still feel like this is a rule you just made up on me. We're not making this up. It's the law. And you know, but the issue is, though, is despite knowing all that, there are some people that are still going to turn to violence. So call the police. Absolutely. You know, my son's back at school now, but when I spoke here last year, I was talking about he worked in a grocery store in town. And I tell you, in an 8-hour shift, it was nothing for them to call the police 2 or 3 times. And I've been grocery shopping all my life. I've rarely seen the police there, but he's coming back with stories. I can't believe it. But the stories he had me worried about him working there. Right?
If I can just jump in on this, I'd say that a couple things. First of all, just to put it in context a little bit, we've the town of Newmarket's had to call the police 3 or 4 or 5 times already. You know, people just walking right by our staff and saying, "Do your best," like calling them out. But the one thing I will say is some of our more senior staff have a considerable amount of experience in de-escalation, and as Trevor was hinting at, talking about, hey, you know, these are not our rules, and by the way, you know, I'm not saying your point's wrong, but that's a point that would be argued in a court of law, not here. And so it just dawned on me, and it happens sometimes. It's happened a few times in these meetings where an idea comes and we can maybe partner on. But you know, you might want to see if there's any interest in the membership, and the town could assist in this and jointly provide like a 1-hour workshop on. We have some people on our staff, and because we have a large customer service department that are have some expertise in this area, and do a 1-hour membership thing on de-escalation specific to COVID, like shape it right around how do you and where do you step back and say, I've done my best, and it's contextual. It'll be different depending on how the person reacts, but it might be something that there might be some interest in.
Fantastic. And that's what I was going to ask also, in terms of how much pushback, how much was your phone ringing when you, from the town's perspective, before the region did it, made that decision for sports from 12 to 17? You must have taken some flack, I would think.
Yeah, we were the first to do it, and it got some flack. But you know, I think one of the things that people have been frustrated from minute one on this is are you able to provide a logical answer that shows fairness and consistency? And once I provided the rationale, which is, you know, because some people say, why are you trying to stop kids from playing sport? I'm not. What I'm saying is, I'm not going to have one 15-year-old standing there being rejected and one being accepted. And frankly, you know, there is a bit of a socioeconomic split between drop-in programming and organized sport. And that's also something I don't think as a society we want to exacerbate. So I said, this is about fairness and process, and I can explain it very logically, and most people were okay with that. They were more frustrated when they get a rule that doesn't have consistency or logic, or when they have no time to react or respond or implement.
I think fair warning is the key, right? Like, it's like, keep reinforcing until November 1st. You know, you just have to keep repeating it, and then hope by then not everyone's going to get it, but that enough people will. One of the questions, does anyone think that eventually all businesses will fall under the mandate of vaccinations?
I think we need a legal opinion on this. I would say never say never. I think that the way the legislation is structured now, with businesses falling under the Occupational Health and Safety Act, that's not an easy change to make. But I also think the Ministry of Labor still wants to uphold the premise of the act, to put it in the employer's hands to do what they feel is best. But you know, their advice at the same time is, we strongly recommend that you create your own mandatory vaccine policies. But I would say never say never. There's a chance that eventually, if that doesn't work, that could happen.
And Trevor, can businesses that aren't sure where to begin with that, can they reach out to Workplace Health and Safety, to you, for some guidance and
absolutely
and recommendations? Yeah. Okay.
Yeah,
I'm sure that would be a great benefit to businesses that don't, you know, want to do it but don't quite know where to start.
Yeah, okay. Absolutely. Yeah.
Now, not to put a fly in the ointment, but I'm not sure who also got the notification today, CBC breaking news, that the first fake vaccination papers are for sale online. So what do we do with that now? I mean, I'm sure we all figured it would come, but what are thoughts on that?
Just very quickly, Jennifer, on the last question, I do think it's important to draw a distinction between essential and non-essential businesses, and restricting people's access to essential businesses is an entirely different ballgame than what's currently on the table. With respect to, how can you verify whether or not a certificate has been compromised or doctored in some way or form? Look, this is something the Chamber isn't terribly happy with the current approach. The paper-based system in which, it's been reported on can be doctored in a Word, in a Word file very easily. It's far from ideal, and it places undue burden on businesses to try to verify the authenticity of these certificates. We are hoping that the soon-to-come QR code will help alleviate some of this, but at the end of the day, the current system, it can be gamed for those looking to game it. It's worth saying the people who are actively trying to game these things is few and far in between. But the current system doesn't have a whole lot of protections for that in place. It does, you got to check the ID and make sure that it matches with the paper certificate. But we hope that a more digital version of this could alleviate some of that.
Well, and, oh, sorry, go ahead, Mayor.
I'll just add that, I mean, the question is, what do you do when that happens? I mean, I'd like to think that there would be a penalty, and a significant one. I mean, because it's not like you can go, I didn't realize this was a fake one. Well, you do, because it's only fake because you're not fully vaccinated. So your vaccination status, I assume, and you're using this, it's a matter of fairness to all the people. And there's some people out there who didn't want to get vaccinated necessarily and did it because they want to participate in a certain way, and others taking a shortcut. It's just wrong. So. I think I think the new system coming in will probably make this debate moot, but for the time being, I hope it's dealt with appropriately. And
now I think it was you, Mayor Taylor. It may have been Daniel at the beginning that threw out the figure on when the proof of vaccine was first announced. It was coming out that there was an influx of people that hadn't been vaccinated, got vaccinated, which I thought was awesome. Do we predict, anybody, that we're going to see even more when you don't have to wave a piece of paper and you're in a dark restaurant and maybe they can't see what it says, but it is an app and it's on your phone and it's a little bit more legit? Do you think we'll see another influx of people that are like, okay, this is serious now, I really should go get my vaccination?
I would say, just quickly, I think it'll have less to do with the app and more to do with getting closer and closer to the deadline, or right after, when people realize, now I really can't get in somewhere. And
right.
Sometimes until you experience you can't come in. So I think it'll be around that deadline. You'll see somewhat of an increase. It'll be interesting to see what happens after that. How many of those that are left are kind of like, no, I'm just not going there. And then, of course, and I know this is also controversial, maybe it'll be one of the more controversial things, but we'll soon be having discussions, if not availability very soon, for 5 to 12-year-olds.
Right.
And maybe, maybe the discussion earlier about, and I know some people won't like to hear about 5 to 12-year-olds being vaccinated, but they are vaccinated for many things. But maybe that discussion about Guam and other challenges in other parts of the world, maybe this is the piece of the puzzle that, can get us that last little bit that seems to be evading total success.
I've heard some talk that we might even see that begin to happen as early as November. Anybody else? Yeah.
I've heard that.
Sorry,
Daniel?
I didn't mean to cut the mayor off. I just want to layer onto this. The one unique aspect of Ontario is our school vaccination policies, in which, for school age children, there is already a host of mandatory vaccines, which if your child is attending a public school, they need to get, or they need to have a valid exemption, which is, either a medical exemption or a sworn affidavit. They have to go to a public health unit, take a class on vaccine education, and get a sworn statement. So importantly, here in Ontario, there's already a protocol, there's already policies in place. Hopefully, when we get to the stage in which these vaccines have been approved and are safe for children, it can be embedded in there so that we can protect in-school learning.
In the meantime, and real quick, because we're running out of time, but here at the Chamber, for those businesses that don't know, we, thanks to Tyler, who has it all organized, we give access to the rapid antigen tests at no cost, any business, 100 employees or less. And I know it was on the news yesterday. Should schools be, should parents, the public, have access to these rapid antigen tests so that if their child has the runny nose, and can they do the rapid antigen at least as a first step?
Just very quickly, Jennifer, going back to our first comment on the tour of the East Coast, they are giving out rapid tests like candy in Nova Scotia for anybody that wants it. And yeah, absolutely. The more widely available rapid testing is available, the greater you stop the spread, particularly in asymptomatic cases. We know that when there was in-school learning at the height of the pandemic last year, they did a targeted campaign for rapid testing at hotspot schools. It prevented a lot of outbreaks, caught a lot of cases. So the more widely available these can be distributed and disseminated, I think the better off we are.
Wonderful. Well, I'm going to throw it to last comment or thoughts, Trevor, and then Daniel, and then the mayor. Anything you wanted to add?
Yeah, I have two quick comments I want to make. We're coming up to the seasonal flu season, which is going to confuse things a lot. So it's something to think about. But something interesting that a lot of people might not realize is that last year's seasonal flu season was almost non-existent, which goes to show you the hand washing, the mask wearing, the extra cleaning here and there works, right? And it's the same for COVID as it is for the seasonal flu. And the other piece I want to say on this call is kudos to Newmarket, because as Mr. Mayor mentioned earlier on, our double vaccination rate is well over 70 or 80%, and the province is sitting at about 70%. So, there's something to be proud of, that this community is a little bit safer than most.
Wonderful. Daniel, anything you want to leave us with?
Certainly would echo what Trevor just said about Newmarket. Look, no business here wants to be the cop or potentially turn away customers, but at the same time, no business wants to be shut down again either. This is one of the tools that we have to prevent that. And we know there's going to be some resistance from some, but we've also heard from members that haven't been included in the vaccine passport policy, personal care services, for instance, wanting to be included. Right. So, there's going to be a learning curve. There's going to be bumps along the way. Urge everyone, particularly the patrons of these businesses, to be patient and look to other jurisdictions where it has been implemented and we know it has produced results. And, hopefully with the QR code coming, it will make implementation smoother and we can get moving on those financial supports from government to help as well.
Thank you. Mayor Taylor, anything you want to leave us with? Last thoughts?
Yeah, I would just say to everybody, I think as was pointed by Trevor, we're doing very, very well as a community and as a region. And I know not just doing well at vaccination rates, but before that at following the public health guidelines, which are still really, really important. We can see from the numbers and the Scarson projections, which are typically right. We can probably hold those numbers down a bit if we stay fairly vigilant. And it's in all our best interest, right? It's and I think of businesses, it may not work for every business, small businesses who have, less flexibility, but creating your own vaccine policy. Think about this: one day when masks are not required, people will be more concerned about entering certain places of business if they don't know that the employees are vaccinated. Mm-hmm. Because right now you feel a bit safe and not as concerned because you're wearing masks. And so I think, again, we have to think about this, like we're in this for, I hate to say it, but this is probably either going to become part of our normal, lives over a year or two, but it's certainly with us for another year in a meaningful way. And we've got to try to adapt to it the best we can. And I think our full focus should be on not allowing any further or greater restrictions and closures and moving towards opening. And we know the answer to that is vaccines. And so, again, just thank you everybody for, I think the community's done amazing. And I think the other part is, and I always talk about this, is the mental health aspect. Forums like this help. Reach out to your employees, reach out to your colleagues, reach out to your friends and other small businesses, check in with them, ask them how they're doing, and give people a chance to work through this, because it's very impactful on people. And I think that part is yet to be fully understood. But that's the strength of community. whether it's a business community or the entire town. There's ways we can help each other, and the ways we can support each other, both in health and in business and the economy and in mental health. Thank you.
Thank you. So thank you to Trevor, Daniel, and the mayor, and everyone else who's been on. But I'm going to end with throwing back to our new president and CEO, Tracy, just to wrap things up on this lovely October 1st sunny Friday afternoon. Tracy.
You've done a fantastic job, Jennifer. Thank you you're like a TV host. It's wonderful. It's been a very informative session. Newmarket is doing so well, and I am really excited to take some of these ideas and help support local businesses to implement and support them any way we can at the Chamber. So thank you, Leslie. Thank you, Jennifer, sorry.
Okay, thank you to everyone. And I think Mayor Taylor will follow up after. That was a great idea about doing some, yeah, Leslie's nodding her head, just some crisis management and some de-escalation. So I love that idea. And thank you, Trevor. So any business that is stumbling a little bit and needs some help putting together some guidelines, they can reach out to you. And thank you, Daniel, as well, for taking the time and letting us know what the OCC is doing with regards to this.
Thanks for having me on.
Thank you, everyone. Enjoy your Friday afternoon. We really appreciate you taking the time today.